My topic is Rasayan and Bajikaran. Speakers, early speakers, that what is the Rasayan and what is the Bajikaran. But my stress is over the Rasayan and Bajikaran with the help of Marma therapy. How we are going to increase the process of Rasayana and the Bajikaran with the help of Marma therapy. And as we know that the Marma therapy is of three kinds. Self-Marma therapy for the diseases, and third one is the follow-up Marma therapy. The self-Marma therapy can be used for the initiation of the Rasayan Karma and the Vajikarana. Just we have to know the common diseases. Second one is evaluate the time and the cost efficacy of these of the Marma therapy and understanding of the herbal medicine and the wisdom of its use for the daily household needs. As you know that we have a lot of rasayans in Ayurvedic literature. Bhallatak rasayan, Amrita rasayan, Amaliki rasayan, Haritki rasayan, and the Pipili rasayan. These 4 or 5 rasayan are commonly used in Ayurveda. And 3 or 4 more things which are called Amrit in Ayurvedic literature. That is Giloy, Rason, Haritki, and Amaliki. These 4 things are very much important in terms of the Rasayan and the Bajikar. And how we are using these Rasayans, how it is working. Doses should be in ascending order and the descending order. What it means? It means when we are starting any Rasayan drug, we have to start the dose from a very small dose. And we have to increase the dose regularly, at least for 21 days. And after that, when we are achieving the maximum dose of the Rasayan, we have to reduce the dose up to the 1 day, in the descending order up to 21 days. The whole 42 days are necessary for the assimilation of this drug for the Rasayan activity. So Brahm Rasayan, and you can say that Chyawanprash Rasayan, Chitrak Haritki Rasayan, all these Rasayan are very important and frequently used in the Ayurvedic therapy. And we can say that the food is the best Rasayan and the best Vajikaran. How it works in the body. When we are eating anything, whatever it is food or it is the drug, it is going into the blood. It is not directly going into the blood. When we are eating, we are chewing, and the process is going on. The digestive process is taking place in the upper mouth and the esophagus, mouth and the stomach. And after that, it is going to absorb from the intestine and going into the liver. It is the best site for making the difference in the blood. And 4 processes are taking place in the blood. First of all, there is oxidation. Whenever we are taking any food, many food are oxidized in the liver. As the drug is also important. When we are taking the, you are taking the tetracycline. When we are taking the tetracycline, it may be oxidized and it may be in the form of oxytetracycline in the blood. You are not getting the tetracycline in the blood. If we are testing the tetracycline in the blood, you are not getting. It may be in the form of oxytetracycline. And when we are taking the oxytetracycline, and it may be in the form of tetracycline in the blood. Because the oxidation and the reduction process, it is very important regarding the food and the drug. So what happens? Every food and every drug gets oxidized and reduced in the liver. And ultimately it goes into the blood and it mixes with the 5 liter of the blood and goes eat and the every part of the tissue. It perfuses the all receptor sites and ultimately it works at the site. The site of the drug in terms of the antibiotic or the analgesic is the site of the lesion where the lesion is. But in case of the Rasayana, the site is all over the body. Each and every particle of each and every cell of the body is perfused by the Rasayana. And these Rasayanas are very important herbs. And in the form of it is previously told that the turmeric or curcuma longa, it is very good. And it is very good for the health. And just we are using these rasayanas according to age, according to the sex, according to the season, and according to the demand of the disease, according to the disease. If the patient is suffering with any urticarial disease or the allergic process, we have not to use any other rasayan. After Sodhan Karma, we are using these rasayanas, and Haridra Khand and Haridra Rasayan or the Rajani Rasayan is very important for these allergic manifestations. And just what we used to do, we used to start giving Haridra powder in a very small dose. We are starting with the 250 mg, increasing the dose as in ascending form order, and after that just we are reducing the dose. It works like anything, because when you are static dose you are giving, a definite concentration of the drug is achieved in the blood. But when you are giving in the ascending order or the descending order, just you are changing the whole process of this assimilation and this oxidation, reduction, biotransformation and detoxification. These two procedures, oxidation and reduction, are very important. But the third process is more important than these two procedures, and that is known as the biotransformation. And what is the biotransformation? Biotransformation means when you are taking anything in the form of food or in the form of drug, it may be biofriendly or it may not be biofriendly. So the process of making the biofriendly, the whole process is taking place in the liver, and the biotransformation takes place in the liver. And in terms of rasayana, when we are taking any rasayana, it is carried by three means. It is carried by lipids, by proteins or amino acids, or by the glucose and the monosaccharides or the disaccharides. So the transportation of these things are carried by all these three things, and the whole blood goes into each and every part of the body. So rasayan and bajikaran is very important for to reduce the aging process. But my main stress, it is the basic thing each and every person knows about the rasayanas, the things which are used in the rasayan or the bajikaran. And just you can say that when in the cold season we are using the Chyawanprash rasayan, but in summer season we are using the Brahma rasayan. We are not using the Chyawanprash in the summer season. We are using the Brahma rasayan in summer season. Now, what we do in the self-marma therapy for the rasayan and bajikaran, I want one volunteer to come on the dais. Just we are doing some practical things. Everybody, somebody can come to the dais. एक कोई आदमी आ जाए हमारे पास, कोई भी आ जाए, तो just we are very much practical. Now, the whole process of the rasayan and the bajikaran is governed by these marma points. And in self-marma therapy, just we are going to activate the whole process. It is not a treatment part, but it is a part for rejuvenating the whole system and to activate the sexual activity of the body. How we are going to increase our power with the help of the self-marma therapy, and it should be done regularly for the rasayan and the bajikaran effect. As we know that there are a number of marma points situated all over the body, and one point is situated at the vitap marm. It is just over the groin. It is situated over this part. And when it gets injured, patient may be impotent and impotency may be there. First of all, we have to start with this part, and during all procedure, we have to keep our hand, right hand over here, and when you are putting this hand like this, the middle finger goes to this part, and it activates the whole axial part of the body, this one. After that, just you have to do only for the 3 times. We are doing only for the 3 times. And another part, just we have to go for left to right, and again we are going to stimulate the upper extremity, and it is 4 finger and 4 finger from this point. 1, 2, and 3. Same way, just we have to stimulate this part over here. And just you can see how beautiful the physiology or the functioning of marma science is there. These two marma are responsible for this part. And with the help of this part, just we are increasing the vitality of the whole part, the chest and the lungs and the heart. With these two marmas, just we are giving power to the lungs and the heart. So, with the help of these Ani and the Urvi marm, we are going to treat this part very effectively, and when these two parts are activated, so the prana is flowing in a very proper way, and prana is very responsible for the rasayan and the bajikaran. Without prana, you cannot activate the rasayan procedure of the body. Now, just you can see the middle part of this R, it is elbow, and elbow resembles to this part, and there is a specific marma point which is known as the Kurpar marma, and with the help of this Kurpar marma, you are going to regulate the function of all the parts situated over here. What kind of structures are over here? You can see there is liver situated just in the right hypochondric region, and there is in between the duodenal sea, there is presence of pancreas is there. It is a retroperitoneal structure. Simultaneously, there is stomach over here, and the stomach bed is made by the spleen. And the whole, these organs can be stimulated by this Kurpar marma. And just you can see over here, there is the Vasti marma. Vasti marma is over here, and with the help of marma, you can stimulate this part. The vitality, the rasayan, karma is situated, is related with this reason. Because without liver, you cannot initiate the rasayan property of any medicine. And with the proper physiological function of this liver, pancreas, and the spleen, you cannot get the effect of any rasayan medicine. And with the help of this Indravasti marma, you are going to initiate the urogenital system of the male, and urinary system and the genital system in female. As you know that urology deals with the diseases of the urinary system and the genital system in female, but urogenital system in male. So we can stimulate for the Vajikaran effect over here, over here, over here, and in the Vitap marma. How we are going to deal with the Vitap marma? I can show you. Whenever we are sitting in this posture and we are doing the Padmasana, this heel spontaneously goes to the Vitap marma, and ultimately it is best for the celibacy. This pose is best for the celibacy. How it is very important. And the same way, when we are doing this, this is the, you can say, this is the inner medial aspect of this ankle joint. And with the help of this Gulf marma, you can stimulate all parts of the lumbosacral region. And all parts below the umbilicus you can stimulate with the help of this Kurpar marma, this Gulf marma. So Gulf marma, Vitap marma, Ani marma, Uri marma, and the marma situated over here, it is Kurpar marma. It is good for the initiation of the Rasayan karma. What happens when we used to take any medicine? If it is toxic, as you know, many medicines having the toxic effect over the human body. When it goes into the blood, it detoxifies. And the toxins, toxic substances, goes away from the body with the help of excretory system, like sweating, like from the respiration, from fecal material, from the excreta, or you can say the urination. All these toxic substances goes away. And with the help of this marma therapy, you can initiate the function of all these excretory organs. So we can improve the vitality and the aphrodisias with the help of these marma therapy. And these are the self marma therapy just you have to do. Now I will show you how we can do the self marma therapy regularly. we have to sit in the Siddhasana. Siddhasana means you are putting this leg just over this point, and just you are going to give the pressure over this Gulf Marma. Start with this point, and you can do this whole process of the rejuvenation and the process of aphrodisias within couple of minutes. If you are doing regularly, you can maintain your health with the help of these practices along with these medicines which I have explained earlier. First of all, you have to sit in the Siddhasana, and you have to keep spine straight, erect, and you have to put your hand on just over here. You have to make the salute. You have to make your hand in this way. You have to keep your hand just over here, and where the middle finger goes, you have to press this point only for 3 times. You have to press this point only for 3 times, because it is generated from the Anganyas and Karanyas. In Trikal Sandhya, we are doing this marma therapy always. It is you can say it is in our daily rituals. We are doing this. So we have to do regularly. If you cannot do 3 times in a day, but you have to do 2 times in a day. And after that, just initially you have to start with the, we have to start with the Ans Marma. It is Ans Marma. For initially you have to press these points for 3 times, and then you have to keep your hand in this way. Another shoulder should be pressed at Ansh Marma 3 times. Again you have to start with the Ani Marma. Just you can see the Ani Marma is over here and Urvi Marma is over here. So you have to start from this point, 4 and 4. It is written that there are 3 fingers are needed, but we are doing over 4 fingers, because when we are giving pressure over here, there is subcutaneous hemorrhage is there. So we are pressing 4 finger and 4 finger. Initially you have to start with the Urvi Marm, then Ani Marm. Urvi Marm 3 times, then you have to shift to the left. Initially start with the right, then go to the left. Initially start with the right, go one by one. You have to press these points. Again you have to press Ani Marma. Again you have to go Ani Marma of this hand. Again you have to go the Kurpar Marma of this Marm. Again you have to go the Kurpar Marma of this Marm. And after that, the Indravasti Marma of the right side and Indravasti Marma of the left side. And after that, 4 finger from this point. Another lecture is there for the exploration. Just I will, I am only giving the precise discussion of this marma therapy in reference to Rasayan and Bajikar. And after that, just you can go for this Manibandha Marma in both the hands, Manibandha Marma. And lastly, you have to go for the Kshipra Marma, and lastly, the Tal Hridaya Marma of the right hand, left hand. You have not to do in the right hand. When lastly, just we used to do Om Astraya Phat. It is the last application. What energy you have generated, you are going to control and save. With the help of this marma therapy, you can improve the Rasayan and the Vajikaran activity of these drugs, and the vitality, you can improve the vitality of your body. Thank you. Thank you very much.